Adrian at the Center for Hip and Knee Replacement in Santa Monica, and this will be a very technical discussion for the process of resecting or preparing the tibial plateau for the partial knee replacement base plate. But before we get into the technical details, and again, this is going to be a very technical discussion of how we prepare the tibia for this base plate, we'll just step back and look broadly. So a partial knee resurfacing is a replacement of worn cartilage on the medial femoral condyle and the medial tibial plateau with a combination of metal and polyethylene. Okay, and the question is, how do we place, position, and prepare these parts so that they fit within the anatomy of the existing knee? Okay. So we're going to talk specifically about the surgical technique of preparing the tibial plateau so that it can accept this base plate. Okay, so we're doing this using a robotic technique, and what we need to do is, typically we see that the tibia is a very flat horizontal surface, but in order to allow this base plate to fit, we need to prepare a surface and a wall with peg holes so that this base plate, with a combination of two pegs and a fin, can fit into that area. And so there are many different techniques that predictably do this, and I'll show you our technique using the robotic with a combination of saw and burr. So we developed this technique over hundreds and hundreds of knee, and so it's done in 3 specific stages. So first we develop the tibial floor, and in 2 stages we do this tibial wall, and then we come in to do the post. And there's a very specific sequence so that we can reach the back portions of the knee. Okay, so step 1 is preparing the tibial floor. So once we've done our 3D modeling of the tibia and determined the size, the rotation, the positioning, and the depth of the tibial implant, we will then create a virtual boundary around the circumference of the bone, beyond which the tip of the saw will not cut. And then that allows us to make this cut, protect this ligament, and protect the posterior structures in the back. And I'll show you what that looks like. So we'll come in, we have our boundaries, and we can see that we can come right along the medial eminence. This is where the ACL attaches. We can come right along the medial surface of the bone where the MCL is, but stay very safely within the boundaries of the bone. And this allows us to make a very controlled cut at a precise depth. Okay. Once we've made this tibial cut, we'll then actually go to the femur, flex the knee up to 115 degrees, finish the femur, and then come back and make this cut. So now this is stage 2. So we haven't done the tibia all at once. We've done this lower cut, and then we'll come back up and work along the sidewall. I'll show you how we do that. Okay, now we take our burr. We're using a different tool, and this gives us a different angle and allows us to walk along the sidewall, work along the sidewall. But once we get here, this burr has a guard, so it will only go so far. So then we'll have to do this in 2 stages. We'll actually have to break the anterior portion, remove it, to decompress this space so that we can bring it in and get the second half, as seen in the photos on the side. And this is the key to the technique. After we've used the saw to cut the floor, we'll use the burr to come and cut this anterior portion. Then we'll bring in an osteotome that allows us to lift it off so that we can gain access to the posterior aspect of the wall. And this is very important. That way this guard on the burr doesn't bind, but it also allows us to maintain the integrity of this tibial eminence where the ACL attaches. So we'll get this very nice prepared surface. And then once we finished this cut and we removed the overlying bone, we now have a flat surface with a straight wall, and then we'll prepare the final step, which is the peg holes. So the knee is flexed at 115 degrees. We'll externally rotate the tibia to deliver the femur, and then we'll use the burr so that we can precisely place our peg holes. Okay, so very short technical discussion on the resection of the tibial plateau so that a person can reproducibly place the base plate of a partial knee replacement. Thank you very much.